Today it's all about hands and what you can do to keep hands looking fabulous. And I've come to meet Dr. Lorenzo Garignani, who is an expert hand surgeon, and he is going to show his latest techniques and he's going to treat my hands too. So here we are at SE1 Medical Aesthetics. Come on in and we'll take a look just what he can do for hands. Lorenzo, what's going on with hands as they age? Is it the same as the signs of aging we see in the face?
We see very similar signs of aging of the hands because the aging goes in parallel throughout our body. So in the hand, because of the characteristics of the hand, which are slightly different from the face in terms of skin, is an aging that shows a bit earlier than the face aging.
Wow.
But people usually do not detect it because...
We never notice it, do we, until we've started worrying about our faces, and the hands come a lot later.
That's very interesting because the hands are probably the most exposed part of our body and they're always before our eyes, but a lot of times we do not pay attention to how they look until someone else notices something.
Yeah, or if you have had things done with your face and you put a hand up and you realise there's a big difference in age between the hand and the face.
That's the main thing, the discrepancy between the face and the hand appearance, especially for people who have had treatments for the face or the neck over a period of several years, and over time then the discrepancy increases.
So what are the things that we see on the hands? Is it wrinkling the skin, pigmentation marks?
You see a combination of things. There are, of course, pigmentation marks coming with aging and also with exposure to external agents like the sun exposure, the so-called aging spots or pigmentation or discolorations of the hand. You may also have scars on the hands that can result from injury or from surgery, and people may want to mask or to cover or to improve simply. And also you may have skin thinning, skin reduced pliability, reduced elasticity, just like in the face. You not only have skin changes, but you can also have structural changes in the hand that show over time. So
they go all bony, don't they? What's happening then?
The hand has to go bony because of changes in the shape and the width and the breadth of bones.
Okay.
So bones change, of course, with time, and also with the use we make of our body.
Sure.
So it's a continuous homeostasis. So basically there is a metabolic change occurring all the time in our body, but not only that. The subcutaneous tissues can get very thin. The veins, tendons, and all the other structures on the back of our hands can start showing more over time, also because they also change over time in parallel with the skin changes. So a number of reasons can lead to the hand appearance to change with aging.
I mean, the key thing that comes across is how vital it is that if anybody is having anything done to their hands, they see an expert, not just somebody with a needle who's a doctor, but somebody who knows exactly what's going on in the hand, because the anatomy of the hand is pretty complicated, isn't it?
Absolutely. It's a very intricate organ because it's sensory, motor, functional, of course, and also an organ for social interaction. So it needs to move well, it needs not to be damaged by any treatment we perform. So for whatever is elective treatment, so planned treatment, like aesthetic treatment, it needs to be as safe as possible. So it's very important to see someone who has a degree in hand treatment. There are diplomas nowadays in hand surgery, both in the UK and internationally. There are diplomas in different countries. There is a European diploma of hand surgery for surgeons who commit to the treatment of the hand. A bit of research is always important before embarking any treatment.
And are there diplomas for aesthetic doctors who treat hands in the way that there are specialisms for surgeons?
There is one now, which is, I'm proud to say, is the first one globally, which is my course.
You teach this?
I teach this, I developed this program especially for this reason.
Okay.
Because I noticed by attending courses and events and congresses over the years that there was a lack of education in the medical aesthetic world on hand anatomy. It's extremely important to treat well the hands, look after them properly. And then there is why I developed this diploma program, which is a practical course, not only theory, with an anatomical approach to hand invasive treatments.
Okay. And you have got a very particular technique, because you're looking at it all from the point of view of how to treat the different layers in the hand and the skin and get the best result for each person. And you have this particular technique called B-FAB?
Yeah, B-FAB is an acronym that stands for booster and filler anatomically based.
Okay.
Because they are the so-called AB techniques, it's like the ABC, the anatomically based techniques.
Yeah.
What I did was to put together my experience as a hand surgeon and knowledge of anatomy with my experience as an anatomy teacher as well. So I've been performing dissections of the hand to identify the safest, not safe, because nothing is safe in invasive treatments.
When you're sticking a needle in, okay,
exactly,
so the
for needles and
for-
cannulas in the hand. And the layers, because traditionally we have been injecting the hand superficially above the tendons and the veins with the concept that anything injected on top of tendons and veins will mask the bony appearance, the tendon appearance and the veiny appearance of the hand, which is true. But we have never thought that actually there is a deeper layer underneath the hand that can also be treated and is safer from a lot of points of view because it's a bit deeper, so it reduces the risk of products showing through the skin as well, or migrating through the skin. And this layer is just beneath the veins and the nerve layer. So it's parallel to the tendon layer. So it's very, very safe from an injecting point of view. Another value of the B-FAB technique, the anatomical booster and filler technique, is that it can associate a deeper treatment for contouring of the hand to a more superficial treatment for skin boosting, which can be achieved by means of injection of polynucleotides or skin boosters, hyaluronic acid based, or even other types of skin boosters. Because there are two different layers in the hand, very well separate one from the other, so the products stay in their respective layer, and you can achieve contouring and skin boosting, so hydration, elasticity improvement at the same time. So this one will be the product we use. It's called Cleanest. It's a polynucleotide. This will stimulate the collagen, and the collagen will increase your skin firmness and protect it from insult when you go to the gym, when you carry out activities. So it preserves your skin. For my technique, I use a very short needle. So I replace the needle with the shortest I can, and I will inject in specific spots on the dorsum of the hand, which I identified based on the anatomical studies, which allow the product to be equally distributed without endangering any nerve or other structure. Okay?
Very brave. Is that all right? Okay.
See, remain very superficial. It's already a short needle. I don't even enter with the entire needle. I only stay in the dermis.
You've got to be intradermal, haven't you?
Yeah.
So what should people look for if they want to choose somebody to treat their hands?
I think they should first do some research. Nowadays it's quite easy to research information, professional information on someone. If in doubt, to speak with the practitioner, go for a consultation. And then, of course, consultation gives a lot of information to both parties, to the treating person and to the treated person. And you can also decide if there is not only enough expertise, but also confidence in the person. To proceed with the treatment. So consultations are paramount, and that's why in the aesthetic practice, consultation should always be carried out extensively prior to considering any treatment, not just the hand treatment.
Do people come in with particular misconceptions about
Yes.
what's happening in the hands?
Yes, there are misconceptions. I've had interesting stories sometimes. I've had someone coming because the veins were moving too much in the hand. There are errors of this kind because of the lack of knowledge of anatomy. That's the reason why these patients should see someone who knows how to explain the anatomy, the biomechanics of the hand, and also how to identify potential misconceptions and correct them.
So with the consultation, which is so key, you'll be taking a person through what they see in their hands, what they want done with their hands, and what is possible. So how does that all go? The
first thing is, in my type of consultation, like I would do for any patient, is to listen to them. So to listen to their perception, to their wishes, and to their point of view. And then, of course, correct any misconceptions, if there are any, and guide them throughout any potential issues and see whether the issue is actually an issue. Because some patients do not require treatment. So, and I'm very happy to advise them not to undergo treatment when it's not needed. So what kind of results can people expect? They can expect certainly an improved contour and hydration, as mentioned, but also they can expect not to impair their function with these
Yes.
treatments. So that's very important, because
Yeah.
there are treatments that may overfill a hand, and that would cause, of course, a restriction of the motion or a sense
Yeah.
of tension. Sometimes they ask me about what about injecting the fingers. I do not tend to inject the fingers with filler, because it would cause restriction of motion
not
or a
much
feeling of
room
tension. It's a
in there,
common
is it?
question,
Yeah. Yeah.
common question about feeling, because the skin creases on the fingers are a matter of concern for a lot of patients. So I would never put a filler there. In terms of duration of treatment, it depends on what has been injected. Usually the products we use nowadays, being polynucleotides, fillers or skin boosters, tend to have a duration of approximately 6 months on average, depending, of course, on what type of product you used. It may vary a little bit, so some fillers may last longer, may last up to 1 year. I've seen cases where they last even longer, but those are cases of patients who do not do physical work or do not exercise much. Because we need to remember the hand is constantly in motion, so depending also on the profession and the hobbies of the person who has that treatment, the duration of the treatment will last longer or a shorter period of time.
One treatment I always think is great for the hands that people don't realise is getting rid of age spots with an energy device.
That's another excellent treatment. The energy devices nowadays are phenomenal. We use Lumecca from InMode for removing age spots, because it's perfect for that depth and that specific type of skin that is the back of our hand. There is a specific protocol for that, and it works fantastically well. The thing about age spots, they disappear, and then, of course, because age progresses, they may reappear in the future. So it's extremely important, in other positions most likely, important to consult the patient appropriately. So the patients don't need to leave the clinic thinking that the age spots are going forever. They need to be aware that after a few months' time or years, there will be new age spots. So it needs to be a rapport and a collaboration between the medical doctor and the patient who's receiving treatment, because there needs to be the awareness of what the future will lead to.
I was only smiling because a lot of people say to me, oh, I had that treatment, but it didn't work. They came back. And you think, well, your skin is aging, the pigmentation will go on revealing itself. It's not that it didn't work, but exactly as you say, these things...
At that specific time in life it worked. And then, of course, age progresses, so you need to undergo other treatments when it's needed.
So it's not a one and done for the rest of your life. You may well need bits more. Okay, fantastic.
So what I will use on your hands today is a hyaluronic acid-based filler with lidocaine as well. So we already numbed the skin with an aesthetic cream, but this will also contain lidocaine. This one, it will be mostly for contouring the hand. So I will use it with the B-FAB technique pattern, so 2 layers, the deeper layer underneath the veins and the nerves with the filler, the superficial layer in the dermis with the skin booster, which will be Hydro Booster, a highly hydrophilic hyaluronic-based booster.
So here I am with my hands all done so neatly with the filler, with the skin boosters, and showing those other treatments as well. I hope that gives you some idea of the range of treatment that Dr. Garignani can offer for hands.